Good afternoon, everyone. It's March 16th. We're having our special county board meeting today. I'm going to call that to order. And instead of an invocation, we're just going to have a stand up and have a quick silent prayer here for a minute. At this time, if everybody join me in pledge allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everyone. Cindy, we'll have roll call. Those that are not here are excused, so we'll move on with public comment. Does anybody have public comment on or off the agenda? We can do that at this time. Anybody have public comment? One more time for public comment. Not seeing any, we'll move forward with our consent agenda. And do I have a motion to approve that? Supervisor Peterson back here. Do I have a second? Supervisor Hanson. We have a motion and a second. Is there any discussion on any of the items on the consent agenda? I don't see any discussion on that. We have a motion and a second, so we will vote on it. That's all yeses. Thank you. We don't have any presentations or recognitions, no annual reports. The financial report?
There is no report,
Nothing on
Mr.
that.
Chair.
Thank you. Then we'll go right into our business item. That's a resolution declaring state of emergency in St. Croix County, Wisconsin, and authorizing the county administrator to take necessary action. And everybody has a copy of that resolution. So I need a motion. Supervisor Peterson. Do I have a second? Supervisor Osnes. We're open for discussion on that. We'll turn it over to.
Thank you, Mr. Chairman. At this point, before we discuss the resolution, I'm going to ask our Public Health Administrator, Kelly Engen, to step to the podium, and she's going to be giving the County Board of Supervisors an update on where things stand with the COVID-19 and St. Croix County's response to it. Kelly, good evening.
Good evening. Thanks for having me. I'd start, but I don't remember what's on these slides. No, I'm teasing. Ken's going to help. No, I think it's the soups. Okay, so you can see our title here is a time to plan, not panic. I think that is most important, and I think I'm gonna do myself a favor and everyone else in the room. Take a deep breath and then relax. It helps me with addressing people of your stature as well. So, do I click? Okay, so coronavirus, it's important that coronaviruses are not a virus that is new to us. they're around, they circulate. This specific virus is a new strain, and this is the one that causes COVID-19. So it is a zoonotic disease, so that means that it originates in animals and then can be passed to humans. So I know there's been a lot of media. I went home a couple days probably over a month ago, and my dad said, oh, it's snakes, the snakes in China. I said, well, Dad, let's take a step back on that. But yes, zoonotic in nature, spread to people. It was first seen in Wuhan, China in December, and we learned about it here. I'll go through a timeline and you can see when we started learning about it here. Signs and symptoms, and this is what we're really stressing right now with healthcare providers: fever, cough, shortness of breath, new to people. Now, if you have lung problems or asthma that causes cough and you always have a cough, has that cough worsened over time or over a certain period? The incubation period has been known to be 2 to 14 days, up to 14 days. The spread is person to person and through droplets. So coughing, that's why you see all the messaging about good hand hygiene and good cough etiquette, coughing in your sleeve, sneezing in your sleeve. All of these things will help reduce spread. Okay, so here's where hopefully you can see. I wanted to give you guys a little bit of a timeline to know how long we have actually been working on this issue. So, as I said, December 31st of 19, this cluster of pneumonias was identified in Wuhan, China, and then has been later identified as COVID-19. Way back in January, the end of January, we had a person under investigation who had returned from Wuhan, China. Luckily, that person did every precaution they should. They called their healthcare provider, they quarantined themselves, and that person's test did result in a negative test. That test actually took 5 days to get back, because that was right away at the beginning. But no positive test there, so we were very happy. So it wasn't until February 5th of 2020, Dane County was, you bet, please.
Who conducted that test and where was the test sent?
So the test was conducted by one of the local healthcare providers in our county, took the test specimen, and then that test specimen went to our state lab of hygiene, and that time the state lab of hygiene was not running tests, so then it got shipped to CDC, and that's why we know it took up to the 5 days. That's no longer the case. Our Wisconsin State Lab of Hygiene is running tests now. And please feel free to interrupt. That's great. Dane County saw the first case on February 5th. It wasn't until a month later. All last week, we were very involved in a response from Pierce County and their positive case. Their positive case had attended a large school event with, I think, 13 different school districts from Northwest Wisconsin that made everybody a little bit nervous. So far, I can say there haven't been any secondary tests to that index case from Pierce County, which is fantastic. And I think tomorrow or Wednesday we will be out of the 14 days, which is a good sign. And we still currently have no test confirmed for COVID-19 in St. Croix County. Uh-oh.
Kelly,
Yeah,
just a quick question,
yes.
and maybe you're going to cover it later on, I don't know for sure. But when the tests are given out, does your department hear directly from whoever gave that test, or does that test results, or the test go to DHS and then come back here?
So that is a really good question that I can try to answer. So late last week, the state DHS gave guidance out that we could share with our healthcare providers who we know are administering the test, that they should notify their local health department of people being tested in 3 ways. Okay, this is what made it crazy for public health. They could do that by our Wisconsin electronic disease surveillance system, which is our preferred way, because then we see everything in our system real time, goes quick, simple, fast. They could call us with a pending test, or they could fax us. And some, because they all have staff who are on vacation as well, some clinics chose to fax, and we're playing a lot of catch up with getting those people into the electronic disease surveillance system, and then making contact with those people to make sure they're in a 14-day hold at home, isolated from the rest of their family. Does that answer, or do you have follow-up?
Yeah, so it's much easier for you guys to hear it firsthand than waiting possibly 2 or 3 days down the road and waiting for DHS to contact you.
Well, so
That's what I'm getting.
DHS doesn't contact us. Typically, COVID-19 has been put in the Category 1 disease, and I know for you guys on our Health and Human Service Board, you know, I talk about communicable disease investigation a lot, and Category 1 diseases say, and the state statute says, local health departments shall be notified immediately of those. I can say that that hasn't happened in all cases, but because our electronic disease system is so good, as long as those people who are getting tested are being put in there by their clinics, it's much easier. So here's a little overview. Now this is at 3 p.m. today. You should also know that the CDC's website, if you go out there, and some of you may have, it only shows Wisconsin still, I think, at like 10 cases or 11 cases, which isn't the most up to date. And we say go to the CDC or go to DHS. As far as case counts, it's changing all the time, so it's really hard to be up to date with this. But as of 3 p.m. today, this is what it looks like in the U.S., in Wisconsin, and then for us here in St. Croix County. So I'll let you take that in. And do you guys have questions at all on whoever?
Just one that, let's say you're coughing and you think you may have it, so you get tested and it's negative, but you keep on coughing, and a week later, you may have it, but since you already had the test,
So
how does that work?
Yep, that's a very good question, and that's a tough one that we've ran into now with, release the test and let anybody get tested. There still is a test criteria that says you should, if you have symptoms, coughing, fever, etc., and there's a big and there, right? Travel to one of the countries that CDC defines as a level 2 or level 3, and you can go out and look at all of those different countries. Or travel to, I believe CDC has only said 3 states in the United States that it's widespread in their communities, and those states are Washington, California, and New York. That really is what's qualifying people to get tested. Now, with that being said, there's a big if. If you're an advocate for your own health care and you go in and you talk to your provider, and the provider has a conversation and you decide that you're going to test without those, that is without any of those other criteria, that's what's made it very difficult for us to decipher, do we have somebody truly at risk here? Because we are not seeing community spread in Wisconsin. It is not community spread yet. Now, that could change by the end of this meeting. But we're constantly monitoring to watch that. So very good question. Hope that answers some of the question. I know it's,
I don't think there is an answer.
yeah. Dan? Okay. So we have been, as I said, this started for all of us in January, and when I say us, Emergency management has been fantastic at helping us put up a virtual EOC, and I didn't have the date of that, but I think Janet probably knows. Way to put you on the spot, huh? Sorry. Yeah, I would concur that that's probably, so with that virtual EOC, we have been able to communicate across departments on a SharePoint site, which has been helpful at times as far as, because the messaging that needs to go out to all the different players has been frankly overwhelming, and with it changing so much, it's added to the chaos. But that is how we're working with emergency management. We conduct contact investigations for anybody who would come back positive. We also are conducting contact investigations for people under investigation. So if you go with go to your doctor and say, hey, I really need a test, if they're in our Wisconsin electronic disease system, public health is calling all those people and saying, assessing their risk and telling them they need to stay in a 14-day quarantine, et cetera, et cetera. CDC and Wisconsin Division of Health recommendations are being implemented, so there's been a ton of work that is done at a county level, really. I think the admin team, as well as a lot of department heads, have been talking about this and preparing and getting ready. As you heard with the resolution that you just discussed earlier, it has been truly a team effort on thinking about things I didn't even think of. Bless the medical examiner's heart, thinking about mass casualties from something like this. We talked, Thursday night late, and I said, why didn't I think of this? Thank goodness you did. So we're all kind of playing our role in the response to this. Oh my gosh, that's pretty slow. So this is what we are trying to do in public health, and some of you have seen this slide. Containment, community mitigation, and you're going to see more of this as the days go on. I know guidance came out today related to social gatherings. CDC had put that out of non-essential mass gatherings of 200 people or less over the weekend. They dropped the number from 200 to 50, and I know there's even discussion at the highest level about even dropping that number, even to 50. So I think we're going to just continue to see more community mitigation strategies. We call them non-pharmaceutical interventions. We know there isn't a vaccine, there isn't medication you can take for this, so we need to do our best by social distancing and other precautions. Wow. Sorry, I didn't know it was. So here are those other measures I talked about, personal. The majority of the people that we have talked to through these contact investigations, they are really being very, they're adhering to what their doctor and public health is telling them. Now, will we get somebody who doesn't want to stay home or doesn't want to do that? In public health, I was taught you take the least restrictive means possible. I want to do everything in my power to not go down the road of having to put quarantine and orders out on places or people or different facilities, and hopefully with the help of community members being so willing to keep everyone safe, that won't be a problem. We're seeing different guidance from daycare workers. Obviously, you all saw schools closed. These are all these NPIs, non-pharmaceutical interventions, that I discussed that is trying to prohibit the spread. Facilities has done a fantastic job as well as staying up to date on how should we clean? Should we put more cleaning measures in place? Should we take keyboards away? Should we wipe the bins out? All fantastic measures to really reduce risk. So this is my last slide. Again, not panic plan. The CDC is a good source of information. It's a ton of information. You can go from link to link to link and then forget where you even started. So exercise that one with caution. I like the Wisconsin State Department of Health website because it really does a nice job at showing you what exactly you're looking at. They have ribbons, and you can collapse them and pick out what you're really looking for. So that is a really good site. And those are the only two sites that we are recommending people go to, along with St. Croix County now has a COVID-19 site that IT folks helped us with and did a fantastic job at helping us coordinate that message.
So I've been hearing that there's a shortage of test kits. And could you comment about the abundance of them or the adequacy of them in this county? And back to the scenario where a person wanted to be tested, but then they didn't meet the criteria because they hadn't just flown in from New York or some other. Is that, in your opinion, hindering the evaluation of what's really out there? Shouldn't we allow testing for anybody that has symptoms rather than also requiring? Could you comment on that?
Sure. So I'll take the first one on the testing and the prohibiting of testing. So what's interesting to me is that during this school event where we had a positive COVID case have interactions with people, I got calls the next day from providers saying, hey, I have a person here who is symptomatic and was at this event. And what we're telling providers is run your gamut of tests first, start testing for RSV and flu. And I can tell you that I know of at least 5 came back positive for influenza A. It's kind of tough when we're in the peak season of flu. And peak doesn't mean we hit a threshold and then we decline. It means we slowly decline over time. So we're going to continue to see lots of influenza spreading in the community. I don't know if I want to give a personal opinion on if I think more tests should or shouldn't be warranted. Does it mean we possibly are not identifying every person out there possible? Maybe, but we also know this is hitting and having most significant impact on our older population. So obviously we worry about them, and they do have stricter guidance for long-term care facilities and aging units and ADRCs, and our staff here at the county have been fantastic about making sure they're on point with all of that. Yep, go ahead.
The other part of the question was how many test kits are available?
Yep, that's what I'm going to. So this is interesting to me because the whole time the national media was talking about, oh, there aren't enough test kits, That simply isn't true. The test kits are a nasopharyngeal swab. So it's a swab that has to go through the nose and hit the back of the throat or the eye. No, just teasing. And clinics are readily equipped with those. The problem comes in is that they have to be sent in a special medium transport, and that, I think, is what people are low on. And that is kind of the holdup. So the test kits themselves aren't. It's the median. They have to be transported in this right median. And the Wisconsin State Lab of Hygiene said that, they're trying to control their amount that they have as well. Now, when I say control, I don't think that means limit, but I think they're just being, again, exercising this caution about who is truly at risk here. Are the right people getting tested among the communities that we know it's readily transmittable? Helpful? Confusing?
So you're not screaming mad about any circumstance right now? Is
I'm
that
really
true?
not.
Yeah, good.
Yeah. Everybody says, are you panicking? And I was panicked in January. If we go back to that timeline, when they said, oh, you just had a person return, I was panicked then, but I'm calmed now. We have a great team and great support here.
Kelly, for those that are probably watching on TV, can you give us an update on where we're at with our nursing homes and then with the senior centers that are being closed right now?
Well, I wasn't prepared to answer that, but I know we spent a long period of time last week discussing this and making sure, as I said, there were stricter recommendations that came out for people at risk, which includes people over 60 years of age. So that all fell into those categories last week. I know our nursing home administrator, Sandy, is on top of this. She's been on top of this. They started locking down and not allowing visitors, implementing testing procedures for staff who are sick, and maintaining those, not just if you have a workforce shortage, which we know is impending, standing by those and making sure those people who are sick are not returning to work until the time, the time frame is up. ADRCs, I know, went, we had a conversation last Friday morning, and they started implementing no congregate meal sites. I can't really speak to how they've progressed today. Is today only Monday? Yeah, I know. It's all running together for me, but they definitely have implemented things, and I think people even who are there was some help with an organization that does tax prep, and they have ceased, I believe, as well.
This kind of, okay, if they close the nutrition sites, are they still delivering Meals on Wheels?
So that, yeah,
Okay,
I think
so-
there were a lot of different alternatives looked at, grab and goes or Meals on Wheels, and then we had the whole question, well, what if my drivers are ill or been in contact or traveled? So we went through that really carefully with, you should be questioning travel and where they have been and where they're coming back from over vacation time is prime here, so.
Can you hear me? This is Tammy on the telephone.
Tammy, I hear.
Go ahead, Tammy.
Okay. I have a question related to Roy's question. So once we do have a community-acquired transmission, then that will change who will be recommended for testing, correct?
I'd have to look very specifically at, I know for sure that yes, the short answer to that is yes, because those people, even a person that has been identified, we would test their close contacts and at least assess them for risk. So the short answer to that is yes, but does that mean it would just blow up into community spread testing? I can't answer that at this point. I can definitely get back to you with an answer. We do have plans that staff said today, well, what is our plan when we do get our first positive test? Because we do know that will happen. So DHS at the state level said they will no longer be putting press releases out for counties if there is a positive test within that county. We have the press templates, and we will absolutely administer that and get that out to media and all of you once our initial contact investigation is complete, which I was on a call, I think, with leadership, and I think the question came about, well, how fast are you getting to those kinds of cases? And I can assure you it is fast. We don't have a ton of nurses, but the nurses that we do have are on their computers monitoring this surveillance system that I talk about, taking faxes off the machine of tests that are coming in that weren't sent through the electronic system. So we're on it. We have basically said, we're not going to implement our other public health nursing priority programs. Everybody is in on the response to this.
Maybe this is a good segue into the pandemic preparedness plan. discussion before we take up any action on the resolution. I just want to speak briefly, or have Ken Witt speak briefly to the Pandemic Preparedness Response Plan. This is for mainly internal use for county employees. And Kelly mentioned that we do not have a confirmed case yet in St. Croix County. If you look at the Pandemic Preparedness Response Plan, it's broken into 6 different phases. The first 3 phases of the plan are basically prevention and surveillance. Those are phases 1, 2, 3. Phase 4 is containment and communicate interventions. Phase 4, and that is currently where we are at as a county. We are, I would say, in phase 4 or possibly 4.5. We are not in phase 5 yet. Phase 5 is the activity monitor, assess, and implement. That's when we actually activate Tier 1 of the COOP plan. It's when we have a confirmed active case, and it's when St. Croix County will go into a modified, reduced staffing schedule. And then phase 6 is the last phase of the plan, and that's the Tier 2 through 4 activation of the COOP plan. But Ken, do you want to speak to any specifics on this, or maybe just take questions from the board?
Maybe just 2 points. You know, public health addresses all of the issues that are out in the public. They're addressing the community. So the county administrator has a plan to address internally, though. What are we doing with our own employees? So one of the things, though, that we have to remember as the government is that we have statutory obligations. So the government will continue to operate throughout this crisis. There will still be law enforcement. There will still be dispatchers. There's still going to be courts. So a lot of these things still have to continue on no matter what the challenges are that we face. And that's why we have a continuity of operations plan. So this plan was put together by the county administrator and his support team with a lot of input from different people. And as the administrator laid out, it goes through the different phases of when we will start reducing those service levels.
Any questions at all? Mr. Chairman, then we're, I guess, prepared to discuss the resolution or
Yep. Do the resolution.
take action on the resolution. I know there was an amendment made
Yep, I know there
by
was.
the administration committee. And I think that the county clerk has the wording in the system. So it is on the resolution. If you have a paper copy in front of you, it's been revised. The administration committee made a revision. Added one last paragraph, and I think the clerk has it there for you. Basically, the resolution declares a state of emergency for St. Croix County. It allows for the eventual potential reimbursement of any state or federal funding regarding our response to COVID-19. The finance department, under Ken Witt's direction, has set up an accounting procedure to keep track internally of any costs associated with our response to COVID-19 in the likely event or eventual event of possibly being reimbursed for our work in response. But to do that, we have to have a formal resolution by the board. It also allows for some discretionary authority for the county administrator to take certain actions, either personnel or other matters related to the COVID-19 response by any county department, with a reporting mechanism built into this resolution for the administrator to report back to the county board on a monthly basis on any action taken in response to the COVID-19 epidemic.
So this, Supervisor,
So what is the change? You didn't highlight what
The
the change was.
change is in, I believe, the last paragraph.
Yep.
Be it further resolved. Does someone, I mean, can you read that, Greg?
says that the,
Dan, if you want.
Supervisor Osterling, you want to-
So that last paragraph is added in its entirety. So everything that starts with that, beginning of that last paragraph is new.
Line 57 on.
Yes, line 57 on.
Do you want to outline what it does, Dan?
Yeah, and specifically, what it does is it says that, the county administrator will report to the St. Croix County Board of Supervisors each month all those necessary changes and exceptions that are authorized above, including the reason for such changes and exceptions, and then grants the County Board of Supervisors the right to suspend any of those changes and exceptions to the existing policy, should the St. Croix County Board deem it them not necessary, or also to rescind the declaration of the state of emergency at any time, should the St. Croix County Board of Supervisors deem that the emergency no longer exists, or that the county administrators exceeded the authority intended by the resolution itself.
Supervisor Hanson.
Another way of saying that is that it reaffirms the county board's authority as it already exists, but it is a comfort zone.
So with that said, that was adopted by the administration committee, so it wasn't amended at this committee, so it's coming down as a complete resolution. So we can vote on that as a complete resolution as it came down from the administration. Supervisor Peavy.
I have a concern on the financial impact in this, and I'm not good at wordsmithing, so I'm just going to, my concern is that could we stop all KIP spending until this is over? That is something we can, this discretionary, we could have a little pot of gold to see us through this. Everything would return back to normal after the state of emergency is over, but if I would be in favor of somehow wording it to suspend all KIP funding until the state of emergency is over, because none of that is very nothing that I know of is that time sensitive. So I don't know how we would do that in the wording.
My only concern with that, Supervisor Peavy, is that several of the KIP projects are already underway. I mean, we're already in the midst of many of the projects, and so to put the HVAC project on hold right now, I mean, the contractors are already working in the building. The jail project is about ready to commence. So I understand your point. I'm questioning whether or not to suspend all KIP projects. At this point, I think would be premature.
Supervisor Peterson.
The committee had a discussion on that also, Bill, Supervisor Peavy, and my feeling, and I think the rest of the committee I speak for, is that right now we need to address this situation as it is. Confident also that the administration is on top of if there is any increased spending occurring or loss of tax revenue, that will act as soon as we possibly can. And it also can be brought up in the administration committee too. So that's where we're at with it.
Any other questions? Supervisor Hanson.
I brought this up just as a discussion earlier, and I'm not a member of the committee, but tax revenue, the economy's crashing right now, and tax revenue is going to be crashing right now, and we won't know it for another 2 months. We don't get those, and Ken can probably be the one who really answers that. I don't know how far the lag of the reports on tax revenue are behind when you actually have the taxes coming in. But my thought was the prudent thing to do would be to stop any new KIP spending until we know what the economy's doing. I've never seen Wall Street have an automatic break happen as many times as we've seen in the last 7 or 8 days of business days. It's scary. And I think personally, I'm just going to throw that out there again. I think it would be, and I'm glad that Bill brought it up again, I think it would be really a good idea to just, and I know that there's projects that are underway, and there's a lot of things, there's a lot of complicating factors to that, but I know that there's discretionary stuff there we can just leave sit. And I would ask somebody to make an amendment, or to, this is an emergency meeting, this is an emergency, and I'm talking about an emergency spending measure to be tagged onto this. So somebody who's smarter than me, come on, let's come up with something.
Pat, isn't that what we have our emergency fund for in case of emergencies? Because we have that fund.
Well,
We could,
I think that the point is well taken. I think that the budget, the 2020 budget, the operations budget, we're going to have to keep a very careful eye on throughout the course of the year, because the point is well taken. I think our revenues that balance the budget are going to be, they're not going to be normal this year. But I think to put a hold on the KIP project, the KIP budget's already funded. I mean, it's not if we're going to be looking at trying to curtail expenditures to offset any loss of revenues or any additional emergency spending, which is most likely going to take place, I think it's incumbent upon the administration to look at our operational budget throughout the course of this year, possibly put some holds, temporary holds. I'm not prepared to speak to specifics on the operational side of the budget to project, to take care of to offset any projected loss in revenues. I think we have to look at it on the operational side of the budget. I think we have contractual obligations on the KIP side of the budget, which is already funded. And so I think, I get the point, but I think we would need to look at the operational budget, and maybe I will try to work with the finance department to come up with maybe a plan to address any shortfalls in sales tax revenue or other revenues that we rely on to balance the budget. I think that's just good management, and I think that you would ask that of your administrator. But I think to look at it on the KIP side is not the right approach.
okay. Supervisor Akhtarov?
Yeah, I got two comments. One, I think this resolution should go forth without including the finances. There should be two separate ones. And in regards to finances, this is why we have a fund balance, that we can dip into it in an emergency. And this is why when we had it way above what the minimum required was a great thing for exactly these type of situations. But irregardless, that's what the fund balance, in my mind, should be used for, is an emergency, and this, I would assume, may possibly fit into that category if it doesn't already. So the KIP is, to me, is something totally separate. We go to the fund balance if we need to, because that's what it is set up for.
Supervisor Dando?
Thank you. Administrator Thompson, what the funds for this are going to, so if we have emergency spending, the funds are, so to hire people, et cetera, where the funds come from?
It'll come from general fund.
The general fund? Is there
Yes.
any kind of an emergency fund, or?
There's no emergency fund in the general fund. It's what Supervisor Achterhoff referred to as our fund balance.
Okay.
We have a contingency fund, but it's not going to address any of this.
Is it possible we run out of that,
Run out of what?
the general fund?
No, I don't foresee that.
Okay.
Supervisor Schober?
Imagine that you're the contractor that is planning on paying the employees based upon the work under the KIP that's already out there, and now you're hearing that even the state and the federal government and the local governments are curtailing those contracts. We can't make the economic hit worse. If we have commitments, let's continue with those commitments. If we have to work on our operations budget down the road, be more austere on that, we can do that. But I also like the idea of having this emergency motion passed without any aspect of the financial hit. That will have to be addressed as circumstances warrant.
So is there any other questions? If not, I think we have that resolution in front of us, a motion and a second. I think it's time to vote on it. That's all yeses. Thank you, everyone. That was the end of our business items.
Before we adjourn,
Yep.
I'd like to pay respect to the presiding judge who is here. I don't know if the presiding judge wanted to say anything to the county board. We have several other elected officials in the room, the sheriff and others. Judge?
Basically, what I'd like to share is this is my 5th meeting today. We started at 8 o'clock with judges' meeting because with the governor's declaration of the emergency on Friday, it changed our entire dynamic and put into place the pandemic plan that we had developed in 2009 with H1N1, which we thought we were going to have to use at that time, did not. So we had the plan in place. This morning, we also entered emergency orders about how the courts will operate. We generally are suspending all jury trials. We're suspending all discretionary court proceedings, but we do have to maintain our mandatory court proceedings. And so the courts will remain operational throughout the time. The order I entered is good through April 10th, and then we'll reassess then, in all likelihood be continuing. But I've been meeting with the sheriff to talk about his population and how that impacts on the courts. I've been meeting with the county administrator and other stakeholders to figure out how this looks. But bottom line, we cannot deny access to the courts by anyone who wishes to enter this building, who has business in front of the courts or wishes to attend to the courts. So we're trying to come up, as I said, with plans and contingencies about how that looks. With the declaration of the emergency, we also have now a new crime that potentially is going to be on the books, and that's violation of an isolation or quarantine order, which is a criminal act in Wisconsin and is a mandatory court proceeding. So that's something, again, that we have to factor in, given the nurses' thoughts about those folks who will not observe or honor a quarantine or isolation. It is a criminal act in Wisconsin. And then finally, with this change, it's placed a large impact on our staff. And there was a question earlier today at a meeting about reduction in court staff. And I don't see that happening, only because, again, of the essential functions that have to be served on a day-to-day basis by the clerk of courts as well as judicial assistants. But I had 60 hearings scheduled for tomorrow, and my judicial assistant said she felt like a telemarketer today, trying to call everyone and try to get things rescheduled or try to do things by telephone or video conference, which will be our preferred method of conducting court. Telephone, video conferencing. But for those that require an in-person appearance, we're again trying to take precautions to protect litigants, to protect attorneys, to protect the public, to protect inmates in the jail, staff, and everyone else. But it's an ongoing process. We're meeting again tomorrow morning at 8 o'clock to assess where we're at and what other things we may need to do as a judicial system. So we'll work again with the county administrator, but bottom line for us is we have to keep the courts open.
Thank you, Judge. Sheriff, anything? Okay. That's it, Mr. Chair. I'd want to thank all the department heads and managers and supervisor staff that are here this evening.
Okay, yep, thank you.
Thank
for
you.
that. Then we're looking at request for future adjust agenda items.
I have one question, and this is going to go to Scott. On the possibility of the elections in April being postponed, since they're going to probably be falling at peak time, does that mean all members of this committee will remain members until there is the election, whenever it does occur?
That's a good question. I'm not sure that I have the answer, but I will give you an answer by email. But I would be surprised if the elections are postponed.
I would not, because that's 2 weeks is...
If the elections are postponed, the 10 members that got certificates, I want them back.
So on the issue of the elections, I know that my friends who are members of the Republican Party are encouraging all their members to vote absentee. So you can request an absentee ballot online, and of course that applies to both Republicans and Democrats. So please, yes, Cindy?
The deadline to request an absentee ballot through My Vote or by mail is March 18th. Otherwise, you're going to do that in person in the clerk's office.
Right, right. So Cindy just said that if you want to request an absentee ballot either by mail or by online at myvote.com, it has to be in by 5 o'clock on Wednesday. Other than that, you can still request an absentee ballot to go visit your municipal clerk. And then even then, you have to get the ballot, fill it out in time, and mail it back in time to get to the election. Right. Or you can bring it as an early vote in person. Another matter that maybe the next board should consider in light of this is that just today, this morning, the Attorney General's office issued a new order saying that open government advisory order allowing more readily and actually encouraging open meetings via virtual technology. And as we heard from Ms. Buthaden earlier on, maybe our system isn't as robust as what it needs to be. So I think for any of us that are feeling a little squeamish even being in this room, close to 50 people already, it'd be nice to have another way of being represented. So I'd encourage maybe a special meeting of administration to consider this and get a special meeting of the board, so maybe the next board meeting can be handled, if you don't care to attend in person, by virtual attendance. So that's just a new agenda item. Thank you.
If there's any other agenda items, just send it to Cindy or Pat or myself, and they'll get forwarded. County clerks, do you have anything? Nothing? Any other announcements? If not, our meeting is adjourned. Thank you, everyone.